Good evening, welcome, and thank you for joining us this evening. I'm very pleased to welcome you here to share more information about Term 2, our planning, and what to expect from DCPS. But first, let me say how proud I am of the accomplishments of the DCPS families. Since March, we've been working together with our staff, our families, our students, our partners, and the greater community to serve the young people of DC. And we've done a tremendous job. We have been nimble, we've been creative, we've been flexible, and we've seen students enjoy learning. And we know that learning must continue. I want to thank our teachers, our educators for their creativity. Their persistence has been unwavering, ensuring that our students receive the very best. To families, thank you also for being co-teachers with us and supporting learning at home. We thank you for your patience, your empathy, and this is greatly appreciated during this time of change as we battle COVID-19. It's been over 200 days since we've been working around this virus, and we're pleased that we are adapting and thinking about ways in which we can provide in-person learning experience for our students in term 2. As we think about our progress and what we've accomplished over the last couple of months, I have to reflect on what we've been able to accomplish in term 1. Since the start of this school year, we have done amazing work again to serve our students. With great pride, I share with you some of the highlights from term 1. We have distributed over 30,000 devices to ensure that every student who needs a device has one for learning at home. We've also supported students with connectivity, ensuring that they have access to the internet at home for learning. We've distributed over 1.2 million meals since March of 2020. We're also proud of our attendance rate. Our in-seat attendance measured by student engagement and login to Canvas is at 92%, which is not far off from where we were this time last year in our in-seat attendance. We also know that there's been great outreach to families. We've had over 12,000 families reached through our information sessions, similar to the one tonight. And then we continue to elevate our Living Through History opportunity, which allows students to reflect and learn from this time period that we're in. And thank you again to our teachers. We had over 4,000 teachers help us launch our virtual classrooms across the district. We have nearly 11,000 Canvas course companions that we utilize for teaching and learning every day. Again, we're so pleased to support you, and we have 2 student support centers already in place where students are learning in person or being supported in person, and we have 11 other ones underway for term 1. As we think about term 2, I want to remind you of where we have spent our time with planning. Before we talk about term 2, I want us to ground us in our North Star principles of what we've been thinking about over the past months that will dictate the future of DCPS during this time of COVID-19. First, we've been prioritizing safety. Health and safety is at the forefront of our minds, and we have very robust protocols for health and safety. The second is we continue to think about ways in which we can maximize learning, whether that's students learning at home or students learning at school. We want them to maximize every minute of the instructional day. And then finally, equity. Equity continues to be a priority for us. Equity in access to resources, equity in learning opportunities. And we know that students have various needs, and those needs look different across our district. And this continues to be top priority for us. As we think about the first one that I mentioned earlier in terms of our planning principles, I want to go deeper on that. So to ground ourselves in the first principle of health and safety, I want to share with you tonight our health and safety commitments. These are commitments that DCPS is making to our students, staff, and families that we're committed to ensure that we honor health and safety. You've probably seen this before, but I just want to again remind you and lift up what our 10 commitments are. and ensure that you know that we're continuing to commit to face covering, cleaning, disinfecting our campuses, ensuring that we limit size of cohorts for social distancing. All these commitments are reflected in our plans and will remain constant throughout our learning opportunities for the 2021 school year. As we think about the days ahead and the months ahead, I want to share with you in greater detail our plans for in-person learning. The mayor held a press conference on yesterday where we shared and announced that DCPS is planning to transition to in-person learning for our elementary age students. And that is students in grades pre-K through 5th grade. Here on this slide, we outline the plan for students and share a little bit more about pre-K 5, but also grades 6 through 12. And it's always important to note among these options, families will always have the option to continue to learn at home. Again, I'll repeat that. Families will always have the option to continue learning at home. And so term 1, we launched our student support centers, which is an opportunity for small groups of students at various campuses to come in for in-person experiences. In term 2, beginning on November 9th, we'll focus on our students in grades pre-K through 5 and welcome them back to our elementary campuses. We will do that in a very strategic and staggered way, and you're going to learn more about that this evening. And then we will welcome back our secondary students in grades 6 through 12 at our middle schools and high schools, beginning term 3, which starts in February, when term 2 ends at the end of January. So, looking ahead, you may be thinking, what was driving the decision for DCPS to transition to in-person learning in term 2? Well, again, as I mentioned earlier, we know that our educators have done a phenomenal job and been very creative and kept our students engaged and encouraged during this time period that we're learning at home. But at the same time, we also know and have learned that learning at home is not working for every student and every family. To determine the best way to welcome students back into our buildings for term 2, we prioritize around 3 key themes. 1, ensuring that we're providing a safe and supportive learning environment that is focused on our youngest learners first. We continue to hear lots of feedback and heard firsthand from students and families that our youngest learners are less independent and learning at home is more of a challenge for our students in grades pre-K through 5, which is why we prioritize them first for learning in person. We also have thought a lot about our opportunity gaps and thought about ways in which we can offer in-person experiences to mitigate learning loss, especially for our known opportunity gaps. And then finally, maximize learning. That's right, you hear that point again. Whether students are learning at home or learning at school, we want to maximize learning time. It's one of the reasons why we held on beginning in-person experiences for our students in grades 6 through 12, knowing that they are assigned to multiple teachers and not one grade level teacher, and that they will transition nationally for most students for term 1 and term 2 for the first semester to different educators and different experiences for second semester, which includes term 3 and term 4. And so given this backdrop, knowing that our youngest learners have been the most challenged with learning at home, knowing that we have some known opportunity gaps and the need to maximize learning, we've created the plans that we'll share with you around how we're thinking about term 2. Term 2 has 3 learning models. For all of our students in grades pre-K through 12, again, they can continue to learn at home with live instruction virtually. For our students in grades pre-K through 5 only, in term 2, students will have an opportunity to participate in in-person learning classroom that mimics the typical day that students have in school prior to COVID-19. And then we have our student care classroom. CARE represents Canvas Academic Real Engagement. In these classrooms, students will be supervised by adults, but continue their virtual instruction at school in the school building. Now, I would like to introduce to you our panel of DCPS and IC leadership to walk through our content today. It's my pleasure to introduce to you our panel, our Communications and Engagement Chief, Shanita Burney, Corie Colgan, who's our Chief of Teaching and Learning, Patrick Davis, who leads operation. We also have expertise in health and wellness. Thank you, Dr. Schumacher, and also planning and enrollment, Claudia Lujan. It's my pleasure and opportunity at this time to turn it over to Corie Colgan, who represents our teaching and learning team. Corie, take us away.
Thank you, Chancellor. So this evening, as the Chancellor mentioned, we're going to take a deeper dive into what reopening schools will look like. We're going to go over, I will go over the overview of our Term 2 learning models, and then my colleagues will talk you through information around the student selection process, safety precautions and preparations, health protocols, and we will have some opportunities for questions live or to be answered live, but it is important to note that there are many, many people on the call tonight, and I know that folks are taking advantage of the chat and adding a lot of questions into the chat, which is great. And we will not be able to answer every single one of those just due to the volume, but we will try to capture as many themes. And then we will also post questions and answers afterwards on our DCPS Reopen Strong website. So bear with us with all of the questions. Thank you. So I'm going to take a little time to dig in a little bit more on the opportunities that the Chancellor just mentioned. So first, for in-person learning classrooms. In this model, we will have in-person instruction, and this will be offered at one class per grade level for pre-K through 5th grade at every elementary school. So in this case, students will be in small cohorts. At pre-K 3, that will be 8 students per cohort, pre-K 4 and kindergarten, 10 students, and 1st through 5th grade, 11 students. They will be working with a teacher and having a full day of live in-person instruction, 4 days a week. The 5th day, Wednesday, will be a half day. That daily schedule will be pretty similar to what you would expect from a typical school day. I also want to name that we will have in-person learning for students in self-contained special education classrooms. For students in this, we will run classrooms at 50% student capacity. So if the class is normally slated to have 10 students in that classroom, we will be able to have 5 students participate in learning in person, and we will have the full staffing model that is associated with that particular classroom. These in-person instructional models begin at the beginning of Term 2, which is November 9th. And as I mentioned, for both of these, this will be 5 days a week. Wednesday will be a half day. The second model is the CARE classrooms. As the Chancellor mentioned, that stands for Canvas, Academics, and Real Engagement. What this means is that students will have the opportunity to come into their school and participate in their virtual instruction, most likely on the same schedule that they have been having virtual instruction thus far, but they'll be able to be in the same size cohorts as I just named for in-person instruction, with a staff member who can supervise them, who can allow them the opportunity to socialize safely with their peers during breaks, recess, and lunch. These programs will begin slightly later than the in-person instruction, so there's a phased-in approach to bringing our students back into the school. The earliest will be our youngest students, so pre-K through grade 1 would begin the week of November 16th. Grades 2 through 5 would begin the week of November 30th. And similar to the in-person instructional program, the CARE program will run 5 days a week, with Wednesdays being a half day. And then finally, for learning at home, which remains an option for all families, students will continue with their virtual learning as they have been this first term, and we will continue to have all of our opportunities for students to learn all content areas 5 days a week, with Wednesday being a day that is more independent in nature. So here is just a quick visual to give you a sense of what in-person instruction might look like for a pre-K through 5th grade student. As I mentioned, they'll be in small groups. They will stay in their classroom for most of the day. We will, of course, have an arrival time, which will be laid out further by my colleagues to talk about how that entry procedures will take place. Students will be provided breakfast in the classroom. They will proceed to have their content area instruction. So you might, in this case, have morning meeting, English language arts in the morning. We will schedule bathroom breaks by classroom to control that. And again, we'll hear more about that when we get into the safety protocols. Important to note that lunch will be in the classroom so that we're not bringing large groups of students together into a cafeteria. Recess will be staggered. And then the afternoon time period, etc. It is important to note that our elective courses, or we sometimes call them at elementary, our inner core subjects, such as art and music, those may be provided virtually to students even in the in-person instruction. So while their classroom teacher will take them through all of the core content areas of ELA, science, social studies, and math, they may engage with their art teacher, for instance, on computers and headsets in their classroom. And then, of course, closing meeting and dismissal. So now we're going to just take a look at what it looks like to be in a student care classroom. So again, this is the model where students are maintaining their virtual instruction led by their virtual instructor, teacher, but they have the opportunity to come into the school and be supported by a caring adult. So in this model, the students, again, are in a small cohort of students. They will, similar to the in-person, they will have breakfast and lunch in the classroom. They will have opportunities for breaks and recess with their peers, and the supervision will be provided by an adult. This will be staffed primarily by DCPS instructional or support staff, and potentially by partner staff from other DC government agencies or community-based partners with which we have a relationship. The role of the staff member who is facilitating a care classroom is to maintain that positive learning environment, to support students if they have any difficulty accessing the technology or their materials online. If any student is having, particular trouble, they can provide support. And they're definitely there also to ensure that all of the safety and health protocols are followed and that transitions, etc., are safe for students. And you can see there the qualifications for our staff that may come in to fill this role. So they do not need to be necessarily a certified teacher, as they are not actively instructing the students, but are rather supporting. So I know that we'll have an opportunity to address a few questions later on. I'm going to turn it over now to my colleague Claudia, who's going to talk about how students will be selected for these models.
Good evening, everybody. Thanks for joining us tonight. I'm going to walk through what the student selection process will look like and what it will consider. As Corie mentioned, we have two different programs that we're offering in-person instruction for, in-person learning classrooms and our care classrooms. For both of these in-person programs, we will be prioritizing students for those available seats. The students that we are prioritizing will be students who are experiencing homelessness, students who receive special education services or English learners, and students who are designated as at risk. For both of those student selection processes, we will be identifying those students and preferencing them for available seats. We also are cognizant that it is important, particularly for families, to try and accommodate siblings where possible, that siblings who attend the same school. So we are trying to also do that as much as possible. We won't be able to guarantee, but we will be providing sibling preference across both in the in-person learning instruction and in the care classrooms. We also understand that families who, for DCPS staff members who are going to be reporting in person and supporting the in-person programming at our elementary schools, we will be guaranteeing their children a seat in a care classroom if their children attend and are enrolled in DCPS and are enrolled within the pre-K through 5 grade band. So we'll be working to identify those staff members and identify their students so that we can provide that guarantee in the care classroom. We also are considering self-contained students. As you know, students with IEPs are in the preference category. We are thinking a little bit differently with self-contained students. We know that our self-contained students have very unique needs, unique staffing needs. Corie mentioned earlier, we will be opening those classrooms at 50% capacity. And so those students will be within their own student selection process where we would prioritize students experiencing homelessness. We will also acknowledge where there are siblings across self-contained rooms and in-person learning and care classrooms. We'll also try to accommodate siblings where possible. There's also a part of the process that we are building out where a school leader may appeal to make no more than 2 seat offers in the in-person learning classroom based on student need. If they feel compelled, they will provide us information on particular students that they feel should be considered and provided an in-person seat. That information will be submitted to the central office and reviewed by central office personnel. They do not have to do that, but that is an option that we are providing our school leaders. I think some key important dates for the families and parents who are on the call tonight. Families will be notified first of the in-person seat availability by October 23rd if they are matched. So what's really important, I want folks to remember, is that unlike the lottery process that very many folks are familiar with that happens every year through My School DC, this is slightly different, and we do not need families to actually submit anything or do anything at this point. So there's no need to apply for a seat. We will be taking all of the students that are enrolled as of yesterday into the universe of eligible students for seats in both in-person instruction and in care classrooms. And so there is no action that a family needs to do at this point. I would encourage families to make sure that schools have updated contact information, email addresses, phone numbers, so that we have the right information to be able to contact you should you get a seat. We anticipate notifying families by October 23rd. If they have been matched for a seat, they will receive both an email from central office notifying them of their match and should expect a phone call from the school staff. It's really important that folks will be given the opportunity to either accept or decline the seat. I want to reiterate that all families have a right to remain in learning from home in an all virtual environment. And so it's going to be really important that if you do not want to accept your match sheet, that you let your school know, that you let us know, so that we can move on to the wait list in an effort to make sure that we can fill the seats. We will be, again, releasing seats for the in-person care classrooms first, then followed by the release of care classroom seats. So families should expect to be notified, again, first via email and then follow up by a call from school by October 30th if they have been matched for a student care classroom seat. And again, families will have the option to always decline that seat and remain virtual. You can move to the next slide. I do want to make sure that folks know, given the time frame, we want to make sure that families have the opportunity to connect with the school, and so we want to make sure that as families look out, you should be looking out for an email if you will be matched. And so that you can either make that decision. Again, I think it's critical. We want to make sure that we have time to go through and make a seat offer available to a family. If you are not interested, please let your school know. And then so that will be a critical point in the time frame. I also want to reiterate that we are not releasing, I said this before, but we are not releasing seats for both in-person instruction and care seats at the same time. There is going to be a delay and a difference between those two timelines. So remember, first in-person learning seats will be offered, then followed by care seats several days later. Next slide. If folks haven't seen already, we have posted on our reopening site some frequently asked questions that we anticipate folks have about the student selection process. I've highlighted a few questions here. I went over, again, the priority groups and also the sibling information. We are going to be working with your schools who will confirm sibling status, and we will get that information over the next few days from your schools. So we will be able to have that and include that as we enter into the random selection process. One of the things that we want to make sure is that, again, if you are not interested in attending either an in-person seat, you always have the right to decline and stay within an all virtual environment, and same for the care seats. Next slide. And with that, I will turn it over to Shanita, who I think is going to walk us through some high-level.
Yes. Good evening, everybody. Again, I'm Shanita Burney, and we wanted to take a breath, and we're sharing tons of information. And while some information is getting answered in the chat, want to make sure that we take a few questions here on what you've learned so far, the learning models and the student selection process. As Corie mentioned at the top of the call, we're getting tons of questions coming through. They're coming in pretty rapidly, and what we're doing is identifying themes. And so wanted to lift up a few questions now that we're seeing pretty consistently. So the first question I'm gonna give to Corie, and I'm gonna combine two questions actually. My child has 20 students in her class. Is there a potential for her to have a new teacher if she goes into the school or stays home? And then accompanying that question, which I think fits well here, is will my child have the same virtual teacher if we choose to keep her at home?
Okay, thank you, Shanita, for raising that. I'm really, I'm glad this question came up because it is important to note that there is a possibility either for a student going to in-person instruction or for a family that chooses to remain all virtual, there is a possibility that your child's teacher may change. We know that that is not ideal, but unfortunately it is unavoidable in this situation. And of course, we will be trying to minimize that, and school leaders will be working to minimize that as much as possible. But I do want to be open and straightforward that that is a possibility that we all need to be prepared for.
Thank you, Corie. I'm going to take a couple of more questions. This is around the student selection process. Please provide more details on how pre-K4 students will be selected to in-person classes. This question has a couple of different parts, and so I'll repeat them as well. Again, more details on how pre-K4 students will be selected to in-person classes, and more information about how teachers' availability will have an impact on proposed choices for in-person learning. So I'll ask Claudia Lujan to kick that question off, and we might get one of our staffing experts to weigh in as well.
So let me run through how it will work for pre-K4, but it's also how it will work across all of the different grades for in-person instruction. So what we will do is we will essentially take all of the enrolled pre-K4 families who have enrolled at the school and put them into a random selection process. We will prioritize among all pre-K4 families. We will prioritize based on the priority groups I mentioned before. Students experiencing homelessness, students experiencing English language learners, students with IEPs, and students who meet the at-risk definition. Though among the pre-K4 students at a particular school, we will rank those students based on those priority orders, and then we will essentially run the selection process and match for pre-K4. It will be 10 students that will be eligible for the seats in that room. For pre-K3, we will match 8 students, and for kindergarten 10, and then first and above, it will be 11. So we will do that across all grades. The way that the algorithm works is super complicated. I'm not going to get into details now, but we do, the algorithm then goes through the process for all of the grades in that school and does accommodate and take into consideration siblings. And so that is something that is built into the model, and that is why we are collecting sibling information from schools prior to running that selection process. I will, I think I can speak a little bit to the staffing question, but obviously we can, other folks can jump in. That is how it will work, but what the other big input to determining how many seats we can offer by grade is, will we have staff to cover that? And so I think staff availability is something that will be layered on and will help determine whether we could open a class for that grade, both in in-person instruction, as well as will determine the availability of how many classrooms we can open in care classrooms in the care program.
Great, thank you, Claudia. The last question that I'll push is if you can clarify if DCPS staff with students enrolled in our elementary schools, if they will have the option to participate in the live in-person instruction.
The guarantee for the staff the guarantee only applies to the care rooms. The guarantee does not apply to the in-person instruction rooms. Now, again, should that family be in one of the priority groups, right? So those students, if they are actively enrolled and are eligible for a pre-K5 seat, along with any other family, again, they would still be eligible in this random selection process, but the guarantee is only applied to care seats.
All right, thank you for that, Claudia. So we're gonna dive back into the presentation. I'm gonna pass it over to Patrick Davis, who's our Chief Operating Officer, to share more information around how we're preparing our facilities to welcome back staff and students safely. And then you'll hear directly after him from Dr. Heidi Schumacher.
Great, thanks a lot, Shanita, and thank you all for joining this evening. And I know it's been a busy start to the school year, so thanks for taking the time to join us. So for folks who have joined us on the past few calls, I'll just sort of reiterate the way I viewed our work, which is really operationalizing the health guidance that has come from DC Health, CDC, and OSCE. So we've taken that health guidance and we're translating that into plans for schools to operationalize and set up to be ready for a safe return on November 9th. So the first thing I'm going to say is that our school buildings are going to look very different. I think we've all gotten used to the very dynamic rooms, a lot of group work. That's going to look very different as we welcome our students and staff back at our elementary schools in November. So on the slide here, you just see a few quick images of what. Go back one. A few quick images of what the classrooms may look like. I'll just say we've started to set up some model classrooms over the past week at 4 of our schools, and we're touring. We've provided the opportunity for school leaders to tour those locations to get their mind around what a socially distanced classroom looks like. But again, all of our classroom setups, all of the entry procedures, all of the corridor transitions, All of that will be guided and grounded in the health guidance issued by DC Health and our city partners. So I just want to get everyone's mind around, our schools are going to look very different, which I think you guys have all thought about, but once you see it in person, it is quite a difference from what we were used to. So if you go to the next slide. So in order to come back safely, we need to make sure a number of things are in place. That applies to both the people that are in the buildings, that applies to the buildings themselves, and then that applies to any sort of processes and systems we're developing with guidance. So the first thing is making sure that all of our staff and students have the necessary PPE and hygiene supplies. So making sure there's a very good supply of masks, hand sanitizer, wipes, anything else that are needed to keep our staff safe. I'm happy to share that all of our PPE orders are on track. We've already received over 1.8 million masks for students and staff. So it's important to know that every staff member and student will have the ability to receive a new mask per day. We have a variation in masks, so we've got traditional disposable masks, we've got child-sized masks for our youngest learners, and then we have communicator masks for any child or adult that may need to read lips. And then additionally, we have face shields for all school-based staff members, and then enough hand sanitizer and wipes for all of our classroom and corridor needs. Next is working with our schools to make sure they have all the necessary cleaning supplies. So we're working with them to supplement and add on all of the cleaning supplies that they normally buy, but every cleaning supply that we're purchasing is in alignment with CDC and EPA guidance. But we know that there's going to be enhanced cleaning and procedures throughout the building. So we know that more cleaning supplies are going to be needed than a normal school year. So we are ready to support that, and we'll be supporting schools directly with additional cleaning. And then, we're working with custodial staff to make sure they are trained and well and understand the new guidance very well, which will focus on enhanced cleaning daily, focusing on high touch areas. The next, as I sort of previewed on the previous slide, working to set up our schools so that we're operating in a very socially distant manner and in alignment with DC Health guidance. So I showed a few pictures of classrooms. So our classrooms will be set up in a way that allows for physical distancing in our rooms, but also still maintaining the character and the feel of a classroom, but ensuring that there's enough space so that kids have enough space and are 6 feet socially distanced from their classmates and the teachers. We'll be working with schools to think operationally about how to handle stairwells. So some stairs may be designated as an upstairs, some will be designated as a downstairs, again, to limit the amount of mixing that happens in the corridors. Additionally, we'll make sure there are hand sanitizer and all the necessary supplies across the corridors, and they're set up in a way that allows for social distancing. And then we'll also make sure there are floor decals on the floor to make sure that students are reminded of the necessary distance between their classmates. Next, signage. We'll make sure there is signage throughout the building, really reminding folks and students and staff that masks are required, encouraging social distancing, reminding about cleaning protocols. We'll make sure that there's signage throughout the building, entryways, corridors, classrooms. It's a good way for us to remind ourselves of the necessary steps to keep each other safe. One of the key building things that we're doing to keep our students and staff safe is turning off the traditional water fountains. That's actually already happened. As you can imagine, a lot of germs are spread through water fountains when kids go to the water fountain. So to avoid that, we are turning off all traditional water fountains, and we'll be installing or bringing in a water cooler service and providing individualized water bottles for students and also disposable cups. So if student, we'll have space and time to fill up their water bowl and get water access, but it'll be done in a little bit of a safer manner. The next is something we're really pleased to share, is that all of our buildings will be going through an HVAC enhancement. I'll just start with the first thing we need to do for the enhancement is actually to get all of our systems operating to a baseline level. So the first step is addressing any outstanding HVAC work orders. making sure that they're functioning the way they're designed to. The next step is actually going above and beyond that, which is doing an HVAC enhancement at all of our buildings. So that includes bringing in additional fresh air into our buildings. So many of our buildings, about 75% of our buildings, have a complete building where they have a complete system where they have what's called a direct outdoor air system, which is a system that's tied into the HVAC system that brings in fresh air from the outside. We're going to be changing the set points and the settings on and the controls on that unit to increase the amount of fresh air that gets circulated and brought into our buildings. That'll help with limiting transmission of the disease. Additionally, we're going to increase filtration in our buildings. So we're going to be switching out the standard HVAC filter with enhanced filters, so MERV 13 and MERV 14 filters where applicable, and that's going to help us as well limit the transmission of, or reduce the risk of transmission. And then additionally, if a school does not have a centralized HVAC system, and if there are issues with any of the enhancement, we have backup options, which is installing what's called a mobile HEPA filter. So these are mobile units that will bring into learning areas and workspaces that will help clean the air, and then in alignment with recommended guidance in terms of clean air settings for healthy learning environments. We are following all of the recommendations from ASHRAE recommendations. ASHRAE is a Society of HVAC engineers that have put out guidance, and we are following that guidance to make sure we are creating very safe learning environments and again reducing the risk of transmission through our HVAC systems. Then the last building related item that we'll be working on in all of our buildings is checking every single sink, lavatory, hot water system to make sure that all of our plumbing systems are working properly so that we're able to do the proper hand washing and cleaning. So we will be assessing every single lavatory, sink, and hot water system across our buildings, all 117 buildings, and then addressing issues that are identified. Next slide. So how do we get from here to November 9th? There's a lot of things that have been in the works for quite some time, but now we're in the final stretch, so we're working directly with schools closely over the coming weeks to make sure they are ready and set up. First is making sure that all of our planning is in place. So last Friday we issued updated guidebook and templates, planning templates for schools to help them develop school-specific plans for safe return. We'll be working with them closely to develop those plans. We've got calls this week with principals and operations staff to walk through that. And as I mentioned in the intro slide, we've set up some model classrooms, and we have set up times for school leaders to tour those spaces as they start to think about their own classroom setups. And then we'll be reviewing those plans centrally for approval, the second and third weeks of October. And then, we move into sort of implementation and setup stage, which is actually starting already. So we'll be working to set up all the classrooms to make sure they're socially distant. All the PPE that I referenced on the previous slide will be distributed. Some of it's already been distributed, but we'll be distributing a whole lot more and all the materials needed to set up the safe learning environments. As I mentioned, we're working with our partners at DGS to address all the essential work orders, focusing on plumbing and any sort of operational impacting work orders, and then by early November have all the HVAC enhancements done. Next is once all the things are in place, so targeting the third week of October, completing walkthroughs to make sure that all of the necessary steps and procedures and processes and materials are in place to welcome students back safely. And then we'll be working with our school leaders the last week of October to set up building walks with our parent and teacher leader groups and union representation to walk them through the things to show all of the steps that have been taken to keep all of the students and staff safe as they return. And then we move into the monitoring phase once students and staff return, and we'll be working closely with our partners at OSSI and DC Health on tracking implementation. We'll be handling the actual monitoring, but following different tracking metrics so we can make sure that once students and staff are in the building, we're following all the necessary protocols and guidance so that we're keeping our students and staff safe, and then we'll continue to work and monitor all the HVAC and building work to make sure those stay working the way they need to. Next slide. Then we're going to move quickly. I know we're running a little bit short on time, so I'm going to move quickly to the next slide, focusing quickly on our health protocols. So we will be implementing the OSCE developed Ask, Look guidance, and it's good to have the parents on the call here because this really starts with you at home. We'll be sending you some tools to work with your families on, making sure that we're asking the right questions before students leave the home. So the first step is asking children about how they're feeling. So there'd be a series of questions to make sure that students are not displaying or feeling any of the symptoms outlined on the slide here. So the first question, the first step is asking them that. The second question is asking if anyone has been in close contact with anyone that is a known positive case with COVID-19. If the answer is yes to that question, we'll be advising you to keep your child and yourself at home and follow the necessary DC Health quarantining protocols. Then the next phase is look. So a lot of this will happen at home, looking for symptoms, but also there will be a number of steps at the school. Arrival process will look a lot different. First, as students, assuming they pass the ask questions at home, there'll be the first step students will go through. We'll have hand sanitizer stations set up outside, so students will get hand sanitizer. Then we'll provide a new mask to put on per day. So the second step is a mask section. Third is health screening verification and temperature checks. So every student will verify that the health screening questions have been asked, and then we'll do a temperature check to make sure that staff and students are healthy enough to go into the building. If any of that poses a challenge or any symptoms are identified, we will have an isolation room identified in the building that will separate any student with a potential positive case. If a guardian is there, we'll send the child home with a guardian, but if a guardian is not there, we will be keeping student in an isolation room that is monitored away from the rest of the student groups to ensure we limit the potential spread of the disease. Next slide. And finally, just to reiterate, we are following all the guidance from DC Health and OSCE in terms of reporting protocols and reporting out. I think the first thing to note, as Corie mentioned that she was going through, we are going to, working to keep kids in cohorts. The intent of that is to actually minimize the spread of the disease and the virus. So kids will be with that group of 11 or fewer students all day for all activities. This is really helpful for us to limit the amount of spread with the virus. So if there is an incident with that cohort, we can actually minimize the spread of keeping that cohort together. And if we do have to go into a quarantine situation, ideally we are just able to quarantine that cohort. And then we'll be working with our school leaders to train on reporting and response protocols. And then finally, for you all, if there is a positive case of a student or staff member in a school building, we'll be messaging that out to the school community about a positive instance, and then working with our partners at DC Health on any sort of quarantining instructions. I know we're short on time, so I'm going to move quickly and jump to Heidi to move to the next slides.
Hello all, thank you so much, Patrick. Good evening, everybody. So I'm going to walk through just a few scenario-based slides around what happens if an individual does test positive for COVID-19. And the principles of cohorting, i.e. keeping a group together, are really central here. And so what you'll see is in this picture, if an individual educator, in this example, tests positive for COVID-19, then students and staff in that given classroom would be notified by the health department and required to quarantine for 14 days. As Patrick was just noting, then the school would follow all steps outlined by DC Health and the Centers for Disease Control and Prevention for cleaning, disinfection, and sanitization, and the entire school community would be notified that there was a case. As is the case with any positive COVID case in the District of Columbia, the contact tracing force from the health department will then interview that positive educator in this case to make sure that they've identified any other close contacts outside of the school setting and would provide individualized guidance for any of those close contacts. In the next slide, we'll walk through a similar case if a student tests positive. So similarly here, you can see in the second grade classroom, there's a student who tests positive. In this case, because the other individuals in that classroom would be considered close contacts, students and staff in that classroom would be notified by the health department and required to quarantine for 14 days, and all the same protocols that I just outlined in the prior slide would apply here too. In the next slide, we can walk through an example in which a parent or a household member tests positive. So in this case, it's a student's parent. This also may be the case of a household member of a staff member. In that case, if the household member is positive, then the student would be required to quarantine for 14 days. And again, similarly, the contact tracing force would interview that parent to make sure they've identified any other close contacts for that individual. And then on the following slide, you'll see that if a given staff member tests positive for COVID-19, including, say, in this case, an office staff member, so someone who may not be in a classroom, but may still be interacting with students and staff and families. Again, the health department would come in and do a comprehensive contact tracing investigation, and any close contacts would be quarantined and fully out of the building for 14 days. And of course, that's essential because we know that close contacts of COVID-19 could develop symptoms or develop the virus over the period of 14 days. And so really making sure that we're reinforcing to families and to staff members that anybody who is identified as a close contact must stay home for 14 days to limit the likelihood of any potential exposure to the school community. In the next slide, I want to just pivot slightly to talk about another really important issue this year, every year, but especially this year. So I can say as a pediatrician myself, one of the things that I worry about most with COVID-19 and sort of the state of health, public health right now, is immunizations. So we know that kids receive many immunizations throughout their childhood, and because families haven't had access to their child health provider or haven't felt comfortable going to their child health provider, the rates of immunization in the District of Columbia and actually across the country have plummeted. And this has raised a real concern about not only having COVID present in our community, but also the possibility of spread of vaccine preventable illnesses like measles, tetanus, whooping cough within our school community and the broader community. And so in a world in which the setting of COVID, things might feel out of our control, I want to really just empower you as parents that getting your child immunized and ensuring that your child is up to date on all immunizations, and we're really encouraging the flu shot this year as well, is a critical step to make sure that your child is safe and that the community is safe. And so as you'll note here, families who receive an offer for a classroom seat must have certification of their immunizations for that child to be able to then attend in person, and that is to limit the possibility of spread of a vaccine preventable illness within the school community. And as noted here, students without documentation of their immunizations will not be admitted for in-person activities. And I believe that is the end of my section, so I will turn it back over.
Sorry, Dr. Schumacher, thank you so much for that. We're going to take the last 5 minutes, the next 5 minutes rather, and get some questions out there on what was just covered, but as well, there might be a few questions that we can get in. We're going to go pretty rapid fire so we can get in as many as possible. And so some of the folks that spoke earlier on the selection process and learning models might be called into. Patrick, I know that you covered a lot with HVAC, but want to make sure folks are hearing and receiving this information. There's a question about their HVAC system at their school being broken, and that it's been operating with insufficient air. I know that there have been others that have asked this question as well. What is being done to ensure, if there's anything different from what you just shared about how you're preparing HVAC, if there's anything more specific around how we'll ensure there'll be adequately filtered and cleaned air?
Yeah, I think I touched on this briefly, but I'll just reiterate that the first thing we're doing with all of our HVAC systems is making sure that they get to a baseline working level. So that's fixing any known deficiencies so that they start working the way they were properly designed. And I did see a few questions about some of the CDC guidance that your sort of CDC notification that came out yesterday about airborne transmission. That's actually why we are doing the enhancements that we're doing. The way we're addressing this is actually by increasing the amount of fresh air into the classrooms. To we're not going to completely mimic what it's like learning outside, but increasing the amount of fresh air is one way to reduce the risk of transmission within the room. And then additional filters will help us for a centralized ducted HVAC system, help limit the amount of transmission that's possible from room to room. So we're really we're attempting to address to minimize the risk both in the classroom transmission, but also room to room transmission through the increased fresh air through the DOS system or the mobile HEPA filters that'll be in the learning classroom. So we are in alignment with what CDC came out, and actually it's the reason we're doing the enhancements that we're doing.
Thanks, Patrick. I'm also going to ask you if DCPS will be providing families a list of renovations that have happened to their school building before bringing students back.
Yeah, sure. So we'll be providing that certainly to the school leaders. I'm happy to share it out. I'll just say we've already got contractors in the building starting on the HVAC work. The same contractors are also doing the evaluation of any of the plumbing systems. So work has already started on that, but we're happy to share the findings of that and summarize what work has been done to make sure that we're safe and ready to return.
Great, thanks, Patrick. The next couple of questions I have for Corie Colgan on our learning model. How are these pods or cohorts going to work, especially for the young students? Are they sitting at their computers all day, or what about breaks?
Okay, thanks for that question. I'm guessing that the question is about the care classrooms where the students are engaging in their virtual instruction. And so, of course, there will be a lot of time that they are engaging in their live instruction with their teachers on their computers. But we do know that throughout the day, especially for the younger students, we have built in break times and opportunities for kids to move around. And so the role of the staff member in those classrooms, and particularly in the younger students' classrooms, will be to provide some facilitated opportunities for students to get some movement or opportunities to socialize with each other in safe ways. And there will also be, of course, a recess time when they're able to go outside. So we are trying to, make sure that, just as I'm sure students are doing in their homes now, they have an opportunity to get up away from the computer and move around a bit when they are on their break.
Great, thank you. Another question for you, Corie. Will there be before and after care options for pre-K-5, whether they're doing traditional in-person or the care classrooms?
I will have to say that unfortunately at this time, we do not anticipate being able to provide before or after care for students in person for term 2. That is something we are hoping to work for, having in place, term 3 and beyond. But at this time, we cannot commit to having it for term 2.
Thank you, Corie. I'm going to ask our Chancellor to pop back in. And there's a question about providing any in-person optional meetups for older students, like PE, sports, or outdoor learning opportunities. And so hoping you can share just a little information about our student support centers.
Yeah, happy to do so. I do want to go back to the before and after school question. So it's important to note one of the challenges with before and after school care is that provides a new cohorting system in which we would have to manage, where students would interact with different students and adults. So that's a consideration for before and after school. Student support centers would be where we would see an opportunity for social interaction for secondary students. We have seen some high schools plan around providing that experience, and we look for more schools to bring that on. It could potentially occur on Wednesdays or after schools or on weekend. And so that is a possibility, but it would be something that a school would have to decide to do. And the staff that participate would be voluntary until we officially establish operations for secondary schools beginning in term 3.
Great, thank you. I know we're close to time. I'm going to take one more question and kick that over to you, Chancellor. Why was the decision made to give just a few students in-person live instruction rather than using a hybrid model that would serve more children?
Yeah, so the hybrid model would be more disruptive, given that we've already started the school year. It would require us to impact many more student-teacher relationship and assignments, and it goes against our principle of maximizing and maintaining high time on task in learning. So we wanted to minimize disruptions. It's also one of the reasons why we didn't make significant shifts for our secondary students. So we believe this allows us, one, to address the needs of those students who may not be experiencing a great experience learning at home, while also prioritizing specific groups of students where we know there have been historically learning gaps and opportunity gaps.
Thank you, Chancellor. I'm going to wrap us up with some next steps and then allow you to close us out. I know there are lots of questions that we've tried to answer in the chat box, as well as lift up those themed questions that we saw trends around here live and in person. And we will continue to cull through many of the questions that we received and updating our FAQ, our frequently asked questions section, on our DCPS Reopen Strong website. And if someone could just put that web link in the chat, I think it's at the top of the chat, but if we could just put it at the, so folks can access it here. And we'll try to get as many of your questions answered as possible. So appreciate folks for raising them. Before we wrap up, want to mention a few next steps. You heard from Dr. Schumacher on how important it is to make sure your child is up to date on immunizations. So make sure if you in particular are selected and choose to come back to an in-person learning or student care classroom, that you're submitting that documentation to your school. You'll need to do that before your child is able to return. Second, we are having a public health panel next week on the 14th from 6 to 7. You can register at the link here. We will post this this presentation and the entire recording of this discussion it'll be on our DCPS YouTube channel. We'll also post it on our DCPS Reopen Strong website. But you can register at that link and hear from some public health officials from Children's National Medical Center. We'll talk more about mental health. There have been many of those questions coming through on the chat today, so we'll be able to dig more deeply into that. So go ahead and register there and plan to attend. And then lastly, look out for notification by October 23rd for in-person learning classroom seats. Remember, you will receive notification, families, if your child was identified as to get a priority seat, and by October 23rd for in-person learning, and then by the end of October, the 30th, for the student care classroom seats. You'll then determine from there if you want to accept or decline that seat. And so look out for that. Great, so those are all of the sort of next steps. Thank you again, and I'm going to pass it over to Chancellor Ferebee to close us out. Thank you.
Thank you, Ms. Burney, the entire panel for the presentation this evening. And thank you, families, for your patience and your empathy. And just remind everyone that we will have walkthroughs of buildings prior to the opening, and we'll continue to monitor schools for compliance of our health and safety commitments throughout any in-person experience. Again, thank you and have a good evening.